Good evening, everyone. Welcome back to The Beauty Matters with me, Lin Hussin, on ALB UK TV. Today, we are joined by Dr. Philippe, London-based aesthetic practitioner, to give us more from his knowledge of health, well-being, and aesthetic. Hello, Dr. Philippe.
Hi, Lynn. Thank you very much for the invitation.
Thank you for being with us today.
A pleasure.
I've introduced you as aesthetic practitioner,
Yeah.
but I want you to tell us more about your background and how you started.
Okay. So my background is, as you can guess by the accent, so I've graduated in France, in University of Bordeaux 2, which is the medical university. And then I came in UK back in 20 years ago, where I validated as well a PhD in dermatology, which is been accepted at King's College, and this is how all started. I started first of all working for model agency as a skin advisor, London, Paris, and Cape Town, and I set up my own practice more than 15 years ago now, and which I have to practice to practice in London actually.
And then you went more in depth into aesthetics to do filler and Botox and more.
Yes, that's correct. My main business now is all about non-surgical aesthetic, but also the regular dermatology issue, acne, psoriasis, those all sort of things, but mainly aesthetic, non-surgical, and the normal, the classic, dermatology issue.
And as when I checked Dr. Philippe website, you do have more than one service. So you are not just focusing on cosmetic and aesthetic. There are wide range of focus on health and well-being, such as weight loss and stop smoking habits and others on services under your clinic. So is it another side you are interested in?
That's correct, yes, because when a patient comes to our clinic and we go in depth about the consultation, we realize there is some other factors. We know that aging, there is different factors, okay? Smoking, pollution, diet,
weight,
diet, and so on. So when you talk about, to your patient, you realize that when they get a bit more trust with our practice, they give you more information. And what I've noticed over the years, then they were very interesting about knowing more about how keeping healthy, not only on the outside but also on the inside. So it's why we decided to provide a bit more than just a quick fix, but it's more about a long-term way of life. Really, it's a healthy life, because someone who is not well inside cannot be really well outside. So it all goes together.
You mentioned the quick fix. So I know that people, when they want to look good, there's filler and Botox, but you give more attention for the skincare and for the long term of beauty care. So you do mesotherapy, we'll talk more about it, and other healthcare services at your clinic. To start with, mesotherapy, what it is about?
Thank you for asking this question, because the first one asking what is mesotherapy. So mesotherapy is a medical technique dated from 1952, is a French technique, which is injectable. What is the purpose of the mesotherapy? Originally, it was used for pain management, and over the 1980s, it went into the rejuvenation of not only the skin obviously of the face, neck, décolleté, hand as well. But what is actually the mesotherapy? Mesotherapy, we know that during aging, the fibroblasts, a specific type of cell, they stop producing our own collagen. So it's why we do filler or botulinum toxin and so on. But how can we reactivate those fibroblasts to produce your own collagen. So there is, the mesotherapy is there to answer those issues. So there is a technique of, needling. More we prick, more, there is some French studies and Russian studies as well, and Spanish as well. So more we notice that we prick, more we activate the fibroblast, those cell who produce your own collagen. Yeah. But also, in addition of the needling, we provide to the skin some nutrients. Those nutrients is a complex of vitamin, mineral element, everything which is provide to those cells the right, environment for the cell to function properly. So it means that those fibroblasts, they will start to reproduce some collagen over the weeks and then the months, because it's not only one session we recommend at the beginning. It's a course of 3. It depends the skin we treated, obviously, but 3 to 5 sessions, spaced 2 to 3 weeks, and then as a maintenance, 1-2 sessions every 3-4 months. I've got actually some patients, they come every month because they love it. They love it. So yes, I always say, okay, botulinum toxin, should I say, or fillers are quick fix because we have a quick result. But mesotherapy is completely different because we really nourish the skin from inside.
Yeah, so it's not external.
Yes, so we have a long-lasting effect who's going to be more beneficial. And the mesotherapy as well, what is the purpose? Is to restore the skin quality, hydration, tonicity, glow, and what every woman wants or love, radiance. This is the when a patient got the radiance, it's a wow. We have the wow effect with the mesotherapy.
So it is to fix problems and as well as like giving glowing and protecting the skin kind of from aging, from honestly the weather here is terrible for the skin anyway. So it provides the skin with nutrients that's needed.
Yes, okay. We live in London, okay, but you can live in Paris, you can live in Dubai, you can live in Doha, you can live in in New York. We are constantly, every day, confronted to, some aging factors, pollution, nutrition, weather. In the Middle East is humidity. It's always damaging for the skin. So mesotherapy will respond because we're just boosting the skin self-defense. So the skin will look much better. If you live in the Middle East, your skin is going to be very dehydrated because of the humidity. So the mesotherapy, or what we call the biorejuvenation, will respond because it will improve the hydration, improve the tonicity, will improve the skin barrier defense. This is the purpose of the mesotherapy. And as well, more we age, the external skin, which is called epidermis, become thicker and the dermis become thinner. So what we need to nourish the dermis, the lower skin, the deep skin, in fact.
We mentioned a few countries here already, so I wanted to jump to the topic of you go to different countries you, as a speaker. So your focus about beauty industry is always raising awareness in different places. Tell me about your experiences in these places.
This is a very interesting, because I had the opportunity to travel in different countries, but not only Europe, okay, obviously in South America, a lot in Asia, in the Middle East, obviously yes, in Europe as well, and in Africa. And this is very interesting how the approach about the concept of beauty has to be approached compared to Europe and other countries. So, but when we look at it, the requests are exactly the same.
No matter
the country you come from, no matter, every single woman, they want the perfect skin. And what is the perfect skin? Is no pigmentation, no scar, glowy, not too dry, not too oily. This is women, they have the same request, whatever country they come from.
And in your, when you go as a speaker, is it because of like a new technique you want to show, or is it raising awareness in general?
So it's both of them, because okay, so there is a new French technique which is on the market, so which is quite interesting because it's suitable for all skin type and respond to the woman request, and also raise awareness, because I go to some dermatology congress, and one was in Kuwait, the other one was in Peru, South America, and it's all about, you know, the topic is always, you know, sun protection, okay, sun protection, because even in Africa, we think that sometimes, you know, how often do we have to apply the SPF? And sometimes you say, you know, I'll go to some congress, and I said, who's got the SPF? Who apply SPF on the face?
So you ask this question.
I asked that question, who apply SPF? And everybody leave their hand, and they said, me. I said, okay, that's good, on the face, yes. What about the neck? Did you apply SPF? And when you more you go down, and less answer, so neck, décolleté, and hands. So no point to have a face who looks 20 years old, and hand who looks 80 years old. Everything has to match. It's what we call the French touch.
Yeah. So where is your next stop? You told me before the show that you're going to Paris.
So yes, so next week I'm going to the International Anti-Aging Congress, which is going to be based in Paris. So it's going to be an intensive 4 days of learning, sharing. You have doctors from all different background coming from all over the world. And it's going to be really exciting because there is always some new treatment coming on the market. Also, we are learning from somebody else's mistakes. So, and it's always not a challenge, but it's good to learn from our peers.
Yeah,
and
so the learning process is always going.
Yes, always.
So hopefully we'll meet you after, and we will know what's new. Everyone interested in knowing the new techniques. I know that you are involved in a society,
yes,
Mesotherapy Society. Can you tell me more about it?
Yes, so we set up the Society of Mesotherapy of UK 6 years ago. The aim was, for specific reason, you know how the UK market is not very, the legislation is a bit relaxed, okay, opposite to other European countries. And so mesotherapy, like I was saying to you, it's an injectable technique. And what we were facing when we set up the society, it's a lot of products which are called mesotherapy in this country are for topical use only. But generally, some practitioners, they think that when they buy mesotherapy products, it will be automatically for injection. So when we train doctors, nurses, and so on, to do the mesotherapy, they are always confused because we always warn them that they have to be very careful what can be injected, what cannot be injected. Because we'll say, if you open the packaging and you read a leaflet inside, it's written in small print for topical use only. So you can tell me, so what's the difference? The difference is for patient safety.
Okay.
What can be injected can be drinking, but what can be drinked cannot be injected. So a product which is not for injection should not be called mesotherapy, because mesotherapy is an injectable technique.
Yeah, I think we raised a question here. So it is a practitioner who will decide to inject whatever material on the patient. What about the patient? Like, do they need to ask about I don't know, the type of material they are injecting, or how can the patient protect himself or herself from injecting things that are not suitable? Is it by asking? Is it like, it's because it's not regulated? So what do you think will help for patient safety?
Thank you, Lin, for asking this question. Okay, at the end of the day, we're not just applying a cream. We are talking about injecting. So yes, the patient's got a right. Okay, when my patient comes to me, it's very important that I ask all the questions, I give them all the information before starting. I say, is everything all clear? Do you want to have some more information? So sometimes when they're not 100% sure, I send them away. I said, get more questions. I'm more than happy to answer to you. So it's very important that as a patient, you need to feel 100% safe. 100% safe on your practitioner, but also 100% safe about the guarantee that the product is going to be used, it's safe as well. So it's why the Society of Physiotherapy, if you've got a concern about the products, you feel free to give us a call. We're going to tell you, yes, this product is safe for injection, or it's not because it's not for injection that it's not good products, but it's not for injection.
And through this society, do you do you raise awareness, or is it in terms of events or people who they come together and ask the questions, or it's just when it's needed? So how do you go about it?
Lin, you're catching me my secret that I've been kept for a long time. And
if you want, you cannot answer.
Listen, for the first time, this year we're going to be part of the International Society of Physiotherapy. We've been very proud to be considered as a scientific society by many congresses abroad. And we're going to organize this year the first, aesthetic mesotherapy in UK. So all to provide some topic awareness. We're only going to get, companies who are suitable for injection, so then for mesotherapy. So for the first time in UK, we are organizing this congress, and you're the first one to know.
Beauty matters.
Correct.
Exclusive for us. Dr. Philippe, you mentioned training.
Yes.
So what type of training? Is it only for filler and Botox, or is it? So what areas do you cover in your training?
So not only for fillers and Botox, we cover different type of training. We cover training for botulinum toxin and fillers, obviously, mesotherapy as well. We do for mesotherapy for rejuvenation, but we do less regularly, twice a year, mesotherapy for pain management. We do as well PRP, plasma, vampire lift, how you want to call. We do PDO thread as well, training. We have peeling, microneedling. We've got a lot of range of training, and they're all for medical only.
Okay. Now moving on from aesthetic and just like facial aesthetic, let's say, lots of questions from lady about cellulite, the big topic. Can you give us any advice how to avoid them if possible, and if not, is there a way of getting rid of cellulites?
So cellulite, unfortunately, men and women are not equal regarding cellulite. The reality is, as an average of 95% of women, they suffer from cellulite. Doesn't matter. It's high percentage. Yes, it's a very high, and doesn't matter the weight. You can be, skinny and have cellulite. Like the opposite, you can be sort of big and have no cellulite. It's nothing to do with the weight. It's more about the body. Unfortunately, it's how the disposition of the fat cell are made in the body, and the disposition on a woman and a man are completely different. It's why women have cellulite and men they don't. So this is the first point. So can you rid of the cellulite? No, you cannot rid of the cellulite. You can improve the cellulite, and by maintaining, you can improve and getting better and better. Okay. So yes, there is some few tips obviously to do. When younger you are, better, less cellulite you will get is by regular massage with caffeine cream, because in fact what you need to do, the cellulite is a very tricky one because it's a combination of different factors. You have, for example, problem of fibrosis, you have water retention, there is different issue. So we have to find out what is the really cause of the cellulite. So it's why it's very important to analyze the patient to see, for example, if they've got swelling ankles, so it's a water retention, to see as well, to feel the cellulite, to get because we need to get an optimum result. And it's a course of 10 sessions for the mesotherapy. And it was one of the 10, between 10 treatment, one of the fourth only who arrived as effective for cellulite.
So we can use mesotherapy for cellulite?
Yes, you can. But it's a course of 10 sessions minimum, and then after you maintain. And I would say we get an improvement of between, it depends the patient as well, because, but normally we can get a good improvement of 80%.
In terms of beauty in general, so when we said beauty for people, it means more aesthetic, for others it means health and healthy skin. So basically, before we started the conversation, I saw how passionate you are about like skincare.
Yes.
There is a study you mentioned as well to me about how important for the woman to have a good skincare. Can you give us some advices about how to have a nice and healthy skin and how it can have an effect in our life?
Okay. So first of all, there is, yes, there is different studies, and you know that the American Dermatology Association, they plan that 50% of adult women will suffer from acne at one stage, 50%, 50.
Yeah,
so it's a lot.
Yeah.
What are the reasons? The reasons are not only hormonal, but are stress. But is the skin routine important? The skin routine is very important. You're right. Okay, when we look at someone, okay, I'm looking at you, you're looking at me. Well, the first thing we see is the skin. So the skin is the biggest organ of the body and is the one we have to look after. So how to keep a perfect skin is common sense. Is we have to cleanse, we have to tone, we have to use the SPF, but SPF, sun protection factors, so minimum 35, ideally 50, okay? So every 3 to 4 hours.
Even in these countries where we don't really see the sun.
Yes, even in this country, when you don't see the sun, even in the winter, because the UV, they're going through the cloud.
Yeah.
So it's very important to apply SPF all the time. So, and remove the makeup. Remove the makeup at the end for women. It's remove the makeup at the end of the day with a proper, eau micellaire, cleansing, and again toning, looking over the skin. And if you have, a dry skin and oily skin, you need to get the right
suitable thing,
the right product. It's not because your skin is your skin. Your best friend has a skin, but it might be different. It's not because the skincare is working on your friend or on your mother or on your sister that it will work on you. You need to get a specific one for your skin. This is everybody's skin, and we don't know if your skin is going to react or not. So it's very important not to apply too many products on the skin.
Okay, so use the same product for a certain time to see if it's working or not.
Yes, and it's good sometimes to have two range, because you can become, not immune but resistant to one range. So you can have a backup if you find that one cream is too rich, or one cream, creates maybe some more, give you some more spots. You have a backup. So it's always good to try two range to make sure that everything is safe for your skin.
We talked lots about skin and health in general, but if we looked around us, especially in social media, I think we are in a time where people are trying to copy, especially in terms of plastic surgeries or aesthetic on the face. So it sometimes goes over the board and started to be the opposite. It's not beauty anymore. What do you think of that?
Social media. We all have social media, okay? Because we all are there to show our work, to show our life, because it's not about only about good things happen. We have to see as well how we live and so on. But we all have social media, okay? So sometimes it goes a bit too far.
Yeah.
Yes, it goes a bit too far. So especially for the millennials, the young generation, because they come to you and they said, "I want exactly." And we know that with Instagram, for example, we use filters, we use, Photoshop, we use all those sort of things. So what you see
It's not
is
true.
not the reality. This is a problem. So, but there is this impact, and sometimes it's so easy to get a very good result without any filter, without any have to retouch your photo. But there is this completely, because the skin need to look completely, perfect. You see sometimes people with Snapchat,
Filters.
the filters and so on. This is okay. It might look good, but for me, it's not the reality.
Yeah.
Okay, this is a fact. It's not the reality. So don't be too much attracted because they're selling a dream, which is just, which is not the reality.
Yeah.
So sometimes they would do everything and anything, and in fact, it's more damaging for the skin than good.
Yeah. Trying to look how good on the photo with the filter.
Correct. And the best experience you do, because we all focus on one thing, and I'm sure when you take a pictures, and sometimes when you're on holidays or with friends, and you look at a picture of yourself, of ourselves, and it's, I don't like that picture, because our mind is always focused on the same thing. And when there is a picture taken by somebody else, taking on a different angle, you notice something completely different. So it's why, when we do procedures, we take pictures, and majority of our patients said, I don't want to see the picture. But it's very important to show the picture, because our mind is always focused on the same thing, but when we show the picture, they said, in fact, your eyes are beautiful, your lips are beautiful, we need to fix this, and it's what makes a big difference.
Yeah, so it has a big impact on our minds, has big impact on our expectation that if I went to do like injections, I will look as this filter give me, like the same look as the filter will give me. And some people get disappointed because it's not a magic thing to do.
Lin, it's not a magic, okay? It's it's like a workout, and personal trainers, they're going to let you know. It's not, 24 hours and tomorrow is going to be fine. But the reality is, for a woman, okay, you wake up in the morning, you look at your face in the mirror. If you love your face, you are going to be Wonder Woman. Your day is going to be amazing. If you wake up in the morning and you don't like your skin, you don't like what you see because you have a spot or anything, your day is going to be very heavy, very horrific, because you're not good. So can you see how the impact on
give confidence.
Give confidence, definitely confidence in your daily life, confidence with your friends, confidence if you go out, with your female friends or with your friend, at work as well, at work. And you were talking about this study. Yes, it's a German study. So, women with a good skin, they've got more chance to be listened by their male partner than women with a bad skin.
That's an interesting study.
This is awful, but this is a reality. It gives more empowerment for the woman. When you have good skin, it gives you more confidence, because you know that it's not only about your skin. It's about how you are perceived by the external eye. What are the external eye? Are you a member of your family? Are your children, your husband, your wife, the colleagues as well at work, and the unknown person in the street? This is the reality.
Dr. Philippe, you work with modeling agencies. Can you tell me a little bit more about it?
A very interesting subject, actually. Thank you for mentioning it. Yes, I work with. I've been working with model agency for quite a long time. It's about education. About how to maintain good skin, how to keep a good skin, because we know that 20 years old, okay, we are beautiful, but when we're getting a bit older, it's not as beautiful. So it's all about education, how for the models male and female models, because it does apply for both of them. It's how to get or to maintain a perfect skin, because models, they, like everybody else, they're teenagers, okay, 17, 18, 19, they suffer like everyone, acne. And when you are in the modeling agency, you cannot afford having, a skin issue. So my job is to advise them how to minimize those issues by having a strict skin routine to help the model agency to get, more models on the spotlight, really.
So in modeling agencies, you are the skin advisor, we can
Yes,
call it.
yes, yeah.
I have interviewed a model a couple of shows ago, and I was surprised that they look to everything in the modeling agencies, such as like skin, hair, nails, because as part of the show, they don't want any mistake within the model, which put the pressure as well on the models themselves. So I think this rule is really important, and I'm sure for people who they work within the modeling industry, because of this pressure of small things they need to focus on, this advice definitely will help.
Yes, for the model agency, actually, what is the most important fact is more about the skin. Because the skin, for example, shooting, it's all about, the photographer doesn't need to change to put a filter. Someone has got a perfect skin, shooting, the photo is perfect. So it helps everyone, okay? Instead of, wasting time to try to retouch the picture, it's all about, natural, all natural. So and the requests are worldwide, in Paris, London, Cape Town, they all want, the perfect skin, the model with the perfect skin. So it's very interesting because we are dealing with young, but always sometimes, a bit stubborn, but they're always quite very keen to learn more how to maintain. So it's very interesting.
Yeah. To end the show with you, I just want to give a message to the ladies. Even if you don't have a perfect skin, that doesn't mean it's not possible or it's unique for a one person. Everyone can have perfect skin through caring, right?
You can today not have a very good skin, but you can get a very good skin as long as you get the right advice.
Yeah.
And the right advice doesn't mean just talking, is going to see a professional and getting the right skin care for your skin type. And I guarantee within 4 to 8 weeks, your skin is going to change 100%.
And your confidence will change.
Of course, of course.
Thank you so much, Dr. Philippe, for being with me today. It was a pleasure having you.
Thank you very much for the invitation, and it was a pleasure talking to you.
Thank you so much.
Thank you.
For you, my lovely viewers, stay with us on ALB UK TV Beauty Matters.